Did you know that out of 100 breast cancers diagnosed in the United States, one is found in a man? I'm Catherine. Welcome to the Inspired Vitality Show. At the time that this video is being published, it is the third week in October, which is Male Breast Cancer Awareness Week. Yes, men can get breast cancer too. In this video, I'm going to recognize some people and organizations, share with you the male breast cancer symptoms, factors that may increase the risk of male breast cancer, and give some great resources for you or the man in your life. Boys and girls, men and women all have breast tissue. The various hormones in girls' and women's bodies stimulate the breast tissue and grow into full breasts. Boys and men's bodies normally don't make much of the breast-stimulating hormones. As a result, their breast tissue usually stays flat and small. Still, you may have seen boys and men with medium-sized or even big breasts. Usually, these breasts are just mounds of fat. But sometimes men can develop real breast gland tissue because they take certain medications or have abnormal hormone levels. I want to share a quote from a male breast cancer patient and advocate. Rod says, "When I talk about the chances men have of getting this genderless disease, I have had women and men come up to me and say, 'I never knew men could get breast cancer.' This got me thinking, why, after over 30 years of awareness raising for women's breast cancer, have we not put the message out there that men can get the disease too?" That was from Rod. Rod and another male Australian with breast cancer created malebc.org as a place for information for men who either think they may have the disease or who do have it. In order to raise awareness, the men at malebc.org ask breast cancer groups to do several things. I'm going to give you a few key points, and you can go to the website malebc.org for more comprehensive information. They ask breast cancer groups to reduce the sexual stereotyping of breast cancer as being exclusively a female disease, advocate for a screening program for men with a hereditary predisposition to breast cancer, provide inclusive imagery and language across all mediums to acknowledge the disease exists in men, and lastly, build a sense of importance and belonging within cancer support groups for male breast cancer patients and their caregivers. The most common symptoms of breast cancer in men are a lump or swelling in the breast, changes to the skin covering the breast, such as dimpling, puckering, redness, or scaling, changes to the nipple, such as redness or scaling, a nipple that begins to turn inward, or pain in the nipple area, and last, discharge from the nipple. These symptoms can happen with other conditions that are not cancer. So if you have any symptoms or changes, do see your doctor. It's important to note that enlargement of both breasts, rather than just one, is usually not cancer. Non-cancer related enlargement of the breast can be caused by medications, heavy alcohol use, weight gain, or marijuana use. Now, the factors that may increase the risk of male breast cancer are many, but I want to cover them all so that you have all the good information. Number one is getting older. The risk for breast cancer increases with age, and most breast cancers are found after the age of 50. Second is genetic mutations in certain genes, such as BRCA1 and BRCA2, that will increase the risk of breast cancer. There's family history of breast cancer. A man's risk for breast cancer is higher if a close family member has had breast cancer. Radiation therapy treatment. Men who have had radiation therapy to the chest have a higher risk of getting breast cancer. Then there's hormone therapy treatment. Drugs containing estrogen, which were used to treat prostate cancer in the past, increase men's risk of breast cancer. Klinefelter syndrome is a rare genetic condition in which a male has an extra X chromosome. This can lead to the body making higher levels of estrogen and lower levels of androgens. Certain conditions that affect the testicles are another risk factor, such as injury to swelling in or surgery to remove the testicles can increase breast cancer risk. Being overweight or obese is another factor. Older men who are overweight or have obesity have a higher risk of getting breast cancer than men at a normal weight. And lastly, liver disease. Cirrhosis or scarring of the liver can lower androgen levels and raise estrogen levels in men, increasing the risk of breast cancer. Now, coincidentally, I did a video about liver disease just last week, and I'm going to link to that video in the description so that you can get some information about that as well. Most men who have been diagnosed with breast cancer will undergo some form of treatment for the disease. The most favorable course of treatment will depend upon a number of the factors, including the size and location of the breast tumor and the stage of the cancer, as well as results of other laboratory tests. So what can you do? If several family members have had breast or ovarian cancer, or one of your family members has a known BRCA1 or BRCA2 mutation, be sure to share this information with your doctor. Your doctor might refer you for genetic counseling. In men, mutations in the BRCA1 and BRCA2 genes can increase the risk of breast cancer, high-grade prostate cancer, and pancreatic cancer. If genetic testing shows that you have a BRCA1 or BRCA2 gene mutation, your doctor will explain what you should do to find cancer early. All men can lower their risk by keeping healthy, exercising regularly, and maintaining that healthy weight. A study has found that men with breast cancer had a poor disease-free survival and overall survival when compared with women. Men also have a poorer prognosis because of their reluctance to see a doctor in a timely fashion. And when they do present, their health practitioners are often not thinking of breast cancer as a possible diagnosis. There is also no screening program for men, even for those with a genetic predisposition to the disease. Because of this, I strongly encourage men to do self-exams, and the Male Breast Cancer Coalition has a short video on its website demonstrating how to do male breast self-exams, as well as a printable self-exam card for men and women. I believe it's our responsibility to learn more about male breast cancer disease so that men with breast cancer are properly diagnosed and treated, and to honor men who have had the disease. I hope that by knowing the symptoms and the risk factors, along with some great resources, you have gained value and insight. Do me a favor and hit subscribe. See you soon.